Senate Bill 90, also known as the Behavioral Health Conditional Dismissal Program, established a pilot project in 11 Kentucky counties selected by the Chief Justice of the Supreme Court. Senate Bill 90 was co-sponsored by Senators Whitney Westerfield, Robert Stivers, and Brandon Storm, and was signed into law by Governor Beshear on April 20th, 2022. The Behavioral Health Conditional Dismissal Program began on January 1, 2023. Its intention is to divert low-level defendants charged with certain non-violent, non-sexual misdemeanors and Class D felonies away from jail and into treatment for substance use disorders and/or mental health issues. The pilot counties are Kenton, Letcher, Hopkins, Christian, Greenup, Madison, Clark, Pulaski, Davis, Oldham, and McCracken. All sites are currently active as of May 2024, and expansion into neighboring circuits and districts is currently occurring. Eligibility for participation is determined by the alleged charge, criminal history, and a clinical assessment performed by a qualified mental health specialist who will ascertain the presence of a behavioral health disorder within 72 hours. Once eligibility has been established, the prosecutor, defense attorney, and the defendant will create an agreement for the participant to enter the program. The goal of Senate Bill 90 is to eliminate barriers to addiction, expand access to treatment, and provide an array of wraparound services to ensure participants' success. The task of establishing and implementing the Behavioral Health Conditional Dismissal Program was given to the Administrative Office of the Courts, the Department of Behavioral Health, Developmental and Intellectual Disabilities, and Kentucky Adult Education. Currently, there have been over 500 participants actively involved in the Behavioral Health Conditional Dismissal Program, all working towards recovery and taking part in their own success.
I'm Angie Darcy. I am with the Administrative Office of the Courts, and I am the Executive Officer of Pretrial Services.
My name is Aaron Pointer. I'm the Director of the Reentry and Employment Services Branch with the Kentucky Office of Adult Education.
I'm Sarah Johnson. I'm the Director for the Division of Substance Use Disorder within the Department for Behavioral Health, Developmental and Intellectual Disabilities. It's been 2 years since we started the Behavioral Health Conditional Dismissal Program.
I know, and it's been a ride. So I think it's, ultimately I would say what is probably the biggest success is our partnerships. So I never thought that I would ever be sitting in the room with adult education and BHDID, and I think it's been fun. Maybe sometimes frustrating for all of us because we've never done anything like this before, but let's talk about like how much we've changed lives.
And how we got started with it. You know, this is such an innovative program, and it really helps us build upon the partnerships we already had, but make us work in a very integrated way to address those barriers that individuals are facing, make sure that they receive necessary treatment, and really divert them from the criminal justice system so early on.
No, I totally agree. I think one thing that has been the most impactful, or really the gem that I've seen, is the deepening of those relationships and partnerships, because when you think about it, we all have the same goal. We want to reduce recidivism. We want to get the Kentuckians the help that they need, and the way that we do that, and we do that the most impactful way, is working and doing it together.
We've all kind of worked in our own little, areas and not really gotten out of those, and I guess we've been isolated to a certain degree, right?
Yeah, we had those partnerships, but now we're integrating the work that we're doing, which I think really makes a difference in how this program works. And, you know, looking at what each of our roles are and how we work together and combine those roles to ultimately create a good program. Behavioral health has been very fortunate to be able to oversee the award from the Opioid Abatement Trust Fund, which has allowed us to have funding for the whole program. And that's been, an important part of our role that we feel very thankful for. And obviously it's very necessary to be able to not only ensure treatment, but also assist with some of those barriers that we know people face. And those barrier relief funding that's available as a result of that has really made an impact and a difference on those lives.
Absolutely. You think about it, like you talk to the silos that we all found ourselves in, working, and we all were doing good work, right? It was good work as individuals, but it's great work together, being able to depend on each other to work through some of those barriers at the administrative level, to come in and really say, hey, what's the best way to help this Kentuckian? Absolutely. What does this individual need, and how do we do it together? Because sometimes it's just removing a speed bump. You know, it's not a roadblock. It's just a speed bump, and we find those workarounds, but we do it together. So I think that's probably one of the coolest things that I have seen myself in working through and standing this thing up.
And we faced some barriers, but the reality is we've been able to work through them because we know what the goal of the program is. And so we've really leveraged our partnerships to be able to work through the issues and barriers that we've faced implementing this program, but then also looking at how can we continuously improve the quality of what it is that we're doing. And that's all been done through this partnership. And ultimately, not only have the participants benefited from this, but we've benefited because we've been able to collaborate in other areas because of the partnerships that we've established.
Absolutely. And then we also look at how much data and other things that we have tracked through this. Like with the Administrative Office of the Courts, we were charged with gathering all the data, and then pretrial was in charge of the eligibility criteria. And what I love about it is that we have found out so much just through the data, and also through the data we can kind of see what's broken as well. So I think that's been kind of neat we've never done that as an interagency. So this is really the first time that all three of our departments have kind of gotten together. We've got the executive branch and the judicial branch actually coming together, tracking data and seeing kind of what's working and not working. And so that, I think that's been kind of a neat process too, right? As we look at it and then kind of collaborate together.
And one of the really cool things, just to build off what you're talking about, is every county is different. But being able to take the best practice framework of like, this is our goal, and really go to these counties and say like, hey, how can we make this program work for you? How can we make the biggest impact utilizing, the funds, utilizing our resources to make that impact that they're going to see the direct benefit? And I think that's something that we've done a really good job showcasing. And I think about, the Office of Adult Education, like our boots on the ground are our college and career navigators. They are tasked to do exactly what the goal is for AOC's side of the house, really, creating those opportunities, making pipelines or developing pipelines, and getting that individual to their level of success with all the resources of the Office of Adult Education and our other partners, right? And so just being able to raise that awareness and raise that partnership, it bleeds over past just Senate Bill 90 or the Behavioral Health Conditional Dismissal Program. It bleeds into the other interactions that y'all staff are having with individuals. And then at the same time, who your people are interacting with. So creating that collective awareness is the ripple effect is really awesome.
I totally agree. And the establishment of the partnerships with the local community treatment agencies as well, because we know the participants that are going through the conditional behavioral health dismissal program very frequently are in need of mental health and or substance use disorder treatment. And so being able to set standards of what that looks like and maintain that list of who those providers are and get the participants connected to them very quickly so that they are able to participate in employment and education services, so that we can remove barriers like transportation and housing so that they can really improve their overall well-being.
Yeah, and I think that's what's kind of magical about the program is that nothing like this has ever been done really nationwide. I think like we're the first to ever do something like this, and thanks to the legislators for drafting the bill. I know sometimes that's a double-edged sword. Sometimes we're like, ooh, but then you get into it, and I mean, it's magical. These are people that have, it's probably their first time ever in the criminal justice system, and they don't know what to do. And so we have these creatures called the case navigators that go out and have a conversation with them and say, hey, can we help you? Can we help, get you back on track? Is there something we can do? Can we get you assessed to see if you have a substance use disorder or mental health disorder? And if they do, I mean, it's life-changing. So.
And then equipping those individuals with that opportunity, right? Providing them and educating them to say, like, this is what's available, and this is, you're not going to have to walk this path alone, right? We have that support structure all around you. And again, going back to that partnership, is everybody singing that same great song of this is the opportunity, we are about your success, and ushering them from the worst day of their life a lot of times to, I think, to one of the photos that I got of one of our participants that had graduated training, and it was CDL training, and was out in front of his semi, right? And it was just the level of pride, and he was beaming, and he had achieved this. And that wasn't the period at the end of the story, right? It wasn't the end. That was the start of his whole career, his whole new life, and just being able to be a piece of that. We have stories like that, across the state, right? And that's what's really cool.
Absolutely. And I think, for all of our departments, we value reentry, and we value the importance of making sure that people have those barriers removed and have an opportunity to change the trajectory of their lives. But what's really unique about this program is the intervention so early in the criminal justice system and the dismissal of charges.
Yeah.
Because we know criminal convictions and that criminal history create its own set of barriers when it comes to employment and education and qualifications for different types of services that may be needed. So what I love about this program is not only are we reaching them early, getting them connected to resources, removing those barriers, but we're also giving them an opportunity to have that criminal charge dismissed, so that doesn't have to be another barrier that they face.
Yeah, absolutely. I mean, I think that is really critical, especially, we don't have anything like that in the Commonwealth of Kentucky for Class D felonies right now. So, that's pretty huge. So if you're charged with a Class D felony, you can actually get your case diverted and you don't have to plead guilty. And right now, the other channels are just a guilty plea. So it's pretty major for somebody to be able to just get a Class D felony dismissed and be able to forget it, expunged, and move on with the rest of their lives. So I think that is probably, like Sarah said, it's probably, just hopefully life-changing.
Well, and you got to think too, it's not one size fits all. And I think that is one of the most beneficial things. It's not a blanket policy. It's not this blanket program that maybe you don't, maybe an individual doesn't want to go to CDL school. All right, that's fine. What do you want to do?
Absolutely.
So it's providing these opportunities, but doing it very individualized, having that real conversation at that early intervention, right? Exactly what you were talking about with the case navigator saying, hey, this is the opportunity. Here's what we can do to help. And then again, when they transfer over to our college and career navigators, them having that one-on-one, what do you want to do and how can I help you pave that path? How can I walk that path with you? And what barriers pop up? Okay, let's work through it. And so I think that is a big driver to the success, is because it's not just, hey, here's this program. If it works for you, it works for you. No, we're going to make this work for you.
Yes, absolutely. And I think about all the success we've seen and all that's come from this program over the last 2 years, and it makes me really excited looking forward. Not only about how we can continue to improve this program, how we can potentially expand this program on a larger scale, but also how we can continue to leverage our partnerships in other areas, because that really, to me, has been so essential in us being successful and us really meeting people where they're at and helping them improve their overall well-being.
What we've really seen is a lot of co-occurring disorders, right? So, which makes sense, right? Because a lot of times you treat your mental health issues with substance use. And so we're actually giving them, your department is giving them the opportunity to actually treat their mental health disorders. And that's not really anything that has ever been, we've ever done in Kentucky before.
And I love the way that we have set this up for treatment, because it's not just about here's a bed and here's a person that needs treatment. It's about individualized assessment and making sure that we are sending people to the appropriate treatment that they need based on what their current needs are, and walking alongside of them, because those needs may change over time. So if they do change, then we're able to quickly respond and send them to the treatment provider that can provide those services.
You know, and one of the cool things is, I'm glad you said that, is being able to, because of the scope of this, is individuals may need some, to address some of those co-occurring issues before they're ever ready to take those next steps to be successful.
Yeah.
But if we equip them appropriately at every step of the way, we just feed their success, right? An individual goes and they have their recovery resources or their mental health resources provided, and they're in a good spot to then say, okay, now I'm ready to enter the workforce. So we're equipping people at every step of the way to be successful, because if you send, hypothetically, if you were to send somebody that didn't have the appropriate recovery or mental health resources to work, is that going to be a good employee? Are we setting that person up for success? But the scope and the scale of this process and how we've, again, grown together over the last 2 years is understanding that, we may have to go to step 1, to 2, to 3, and it may take some time, but that investment and that intentional investment in that person equals their success.
So thank you for joining us and listening to us about our past couple year journey on BHCDP, and we hope to regroup in another couple of years and have even more success stories and more engaging discussion about this.